Hello, this is Zach Brooks with UGenome. This is an onboarding video to give you some sense of what we're up to and the important role you're going to play with the team for a short or long time. So how you got here. So we had some sort of initial contact, some sort of screening initially, a version of an interview, maybe one-on-one, one-on-two, maybe one at a time. And then some of you had an offer letter also very shortly, or you already done it. You're going to sign an NDA, a complete orientation, which is part of today. And of course, some of you will get access to G drives and some other things from UGenome. The overview for today's orientation is this. We're going to talk about our mission, vision, values, our genes of values first. We give you one of our whys, why we're doing what we're doing and why it's so important. You're going to meet some UGenome people. I would suggest pausing during that if you wanted to learn anything more about them. We'll have a couple introductions on sequencing, products, services, also continuous improvement, very much operations, quality control, a marketing introduction, and finally, very, very importantly, a social engineering, so things such as phishing and different types of scams that you might come across. It's important for us as a company to make sure we're protecting data at a very, very high level. And so this is why we have this as a part of the orientation. Immediately think about data protection and the people you love. So genes of values, our mission, vision, values. So if we capture them in a visual, we have our mission, vision, values, product philosophy, management philosophy, quality of operations, and all of these things are really our differentiator as a company more than anything else. So why we do what we do and how we do what we do. So we have our mission, our vision, our values, and then kind of the way doing things, but please help us get better. So when talking about a mission is daily activities to accelerate the benefits of genomic medicine for patients and healthcare professionals through clinically actionable insights. Our vision, what we say the most, is to make genomic medicine personal and accessible for everyone. Our values, we have 7. Number 1 is curiosity. We learn and teach, so we're doing complex work. We need to learn that and be very curious about that. We have empathy, respect for complicated lives, trust. We're honest and transparent with what we believe our capacities are, and we believe in constructive candor with each other. Number 4, diversity. Diversity by itself is very important, but in terms of diversity of data sets, extremely important to help very specific patients get very specific treatments. Adaptability, innovation, and excellence. It's one thing to be good one time, but how are we good over and over again? Adaptability is important. Being a technology company and innovation is very important as well. We're really driven by curiosity and collaboration to try something new. We hope you want to try something new as well with UGenome. So how do we do what we do and putting you in a position to succeed? So first of all, you belong, we all belong together. We try to set some standards and principles for our behaviors, from agendas to meetings and individual work. We want you to learn something from this experience. You get to ask yourself what that is. And finally, we're trying to reduce friction in our operations and be really efficient with our time by not overburdening people. For example, we want this entire orientation experience to be an hour or less so that you can work with us very, very quickly and you can get to other parts of your life which are very important to you. So how do we do what we do? We lead by example. We prioritize punctuality because we want to respect everyone's time. And if not, give us a heads up when you're running behind. We have an agenda always because we want to accomplish one thing during every meeting to make ourselves feel good at the end of the meeting. Treat everyone with respect. We get farther together. We want you to do one thing you love, one thing you like, and one thing for the team. And finally, creativity comes from efficiency. So don't kill yourself. Try to do one thing at a time very well and take some time off for yourself because your mental health is good for how we do business together. So your role. So this is going to be very high level. Some of you are going to have a job description. Most of you will. Some of you won't because the positions are informal. But in that job description should be a good outline of what we would like you to do. We don't want to overburden you because we want to put you in a position to succeed by giving you manageable, clear tasks. I think the other thing that's really important is that learning is our number one value. So we want you to learn from this experience. And how do you learn best? I want you to lead by sharing your knowledge and being a good teammate, because we get better together. And finally, live and find time for yourself. We don't want to exhaust each other. If we're going to be any version of healthcare company, we have to treat each other first with lots of health. So our commitment, we're dedicated to giving you at least 3 experiences that you can proudly showcase on your resume and cover letter to help you achieve your personal and professional goals once your time with UGenome ends. If you stay longer, great. Why we do what we do. So let's talk about adverse drug reactions. Imagine this stadium full and then everyone gone. This is the Rose Bowl in Pasadena near Los Angeles. 106,000 people die every single year from adverse drug reactions in the United States. That's a huge amount of people who die simply because they took a medication prescribed to them. Now, in the United States, this is a $500 billion cost. 106,000 deaths, 1.3 million ER visits, 350,000 hospitalizations. It's the 4th leading cause of death, with 5 billion prescriptions issued annually. We can do better. This is one of the reasons we exist as a company. Worldwide, there's 23 million adverse drug reactions. In Europe, there's almost 200,000 deaths per year from adverse drug reactions. In the United Kingdom, there's almost 100 million pounds that are spent on avoidable adverse drug reactions. If we move to South Africa, we can see that 8.4% of all medical admissions are due to adverse drug reactions. A large number of deaths, almost 3%, are due to adverse drug reactions. And 16% of all deaths in South Africa can be attributable to adverse drug reactions. We can do better. That's why we exist. So, pharmacogenomics is a study of individual genes, how individual genes affect medications they received. Another way to think about this is medication response. You take medication, how does your body respond? But it's not just about medication response. It's also about safety and efficacy. That's why we exist, to do what we're doing. So safety means preventing, using a patient's information to prevent adverse drug reactions, hopefully ahead of time. That's the preferable outcome. Efficacy means referring to how an individual's makeup influences a drug's ability to produce the desired therapeutic effect. So now you get to meet a few UGenome people. I would suggest pausing at any point to study anyone's individual profile a little bit more. But the co-founders are myself, Jaden Lee, and Peter Bannister. So we'll start with Peter. PhD in engineering from Oxford, been around multiple life science companies in his professional career. Started in South Africa in his life, but now lives in the UK. Really lucky to have Peter. Very strategic, very smart, always very helpful, a great teammate, a really smart person to work with. Dr. Jaden Lee is our Chief Genomics Officer. Started his life in Korea, United States, and now he's in the Netherlands. He leads our product team development and our services, especially the PGX services that we have as well. So great teammate. Kamal Sharma started in India, lived in Africa, and at this point lives in the United States. She's also, with Jaden, the key driver behind our product development. We're super lucky to work with Kamal, a fantastic leader, very friendly, very helpful. Hasna Rahim is a pharmacist, started in Afghanistan, lives in the United States. Anytime you see something online that's emerging trends, Hasna is behind the scenes, making sure that our editorial guidelines are the highest standards, so we're producing high quality content for the audience. Miley Nguyen started off in Vietnam, lives in the United States, did her pharmacogenomic pharmacist training at Harvard. So she's excellent, certainly trained, but she's a great person to communicate information when it comes to complex pharmacogenomics, medication response information. Marco Schito from Canada, also grew up in Italy with the NIH for 15 years. Any scientific question you can throw at him, he'll have some very good answer or can research it very quickly. We're so lucky to work with such a very talented, smart person. Ben Stansfield is from the United Kingdom originally, doing his PhD in the United States. He's our Director of Computational Biology. Also like others, a fantastic communicator of complex computational information and biology. Biology is more important than computation. It's good to explain both. Sophie Tahiri from Morocco and France in the United States, finishing her PhD at George Washington University, has a background in molecular medicine, patient advocacy, clinical trials, etc. We're super lucky to work with Sophie, a great talent. Munda Mundenda is from Tanzania originally, doing his PhD in Czechia, formerly the Czech Republic, has lots of experience when it comes to labs, and he's making connections for us in South and Eastern Africa. Finally, a little bit about me. So this is my 5th startup company. All have been in different technologies. This is the most exciting because of all of the people that you just saw in our quick introduction to the people section of UGenome. Looking forward to meeting you in person sometime soon. Sequencing introduction. 3 kind of things we'll talk about briefly. Number 1, DNA microarray. Number 2, next generation sequencing. And finally, 4th generation sequencing. We're going to have other training later to go into more depth in all of these things we're introducing during this orientation. DNA microarray. So it's fantastic. You look at relative concentrations of many different DNA sequencing. The problem is that there's some limitations. The limitation is that the array has to be designed to detect very specific things. And if it's not, you're getting some weird results. Now, if you can design an array for exactly the thing you're trying to detect, this is fantastic. So it's important to know a little bit about the technology. Again, more depth later to see where we're going next. And where we're going next is where we are now when it comes to sequencing and the information we work from, next generation sequencing, whole genome sequencing, and whole exome sequencing. So massively parallel sequencing technology used to study genetic variations and mutations. It's incredible because you can do thousands of genes in a short period of time, but it's more expensive. Again, whole genome sequencing data, whole exome sequencing data is what we work from. Both are important. Whole exome sequencing is a little less expensive, but you get a lot of the same bang for the buck. We can also work with targeted sequencing information that's even less expensive than the other two, potentially, as long as you have the setups to do that sequencing. But then you have to very, very specifically target a number of genes. Now, that's really good for cancer research and some other things as well, very specific cancer research, for example. The final thing we'll kind of talk about briefly is 4th generation sequencing. So major advantage is that this technology is fast and can measure long strands of DNA. So then you get less particles and less inaccurate information when you're doing 4th generation sequencing. So, for example, the bioinformatic challenges for some gene regions are more easily resolved with long read 4th generation sequencing, resulting in higher accuracy compared to the standard NGS, next generation sequencing, that use short reads. Now, this is somewhere we're going to be going, which is why we're introducing this during the orientation. If you hear about 4th generation sequencing, at least you have some small sense of what it is, but please look it up on your own in Google and other AI tools. A little bit of our product's introduction here. So really importantly, we have a product philosophy that's very much from our mission, vision, values. Number 1, we're patient-centric. Number 2, everything we build has to be clinically relevant and actionable because there is a person that someone cares about who is going to be helped by our product indirectly or directly. Should be accessible for all, interoperable for whatever system in place. We want to constantly have innovation and adaptability, very much excellence. Really importantly, we're going to have ethical data stewardship when it comes to our product builds. And finally, we care about interdisciplinary collaboration. We're doing great things, so are others. All of us together, what we think, should be building things for humans to get better treatment options. There's someone that you love and care about who's going to be in a hospital setting soon or a clinical setting soon, and we want them to get the best treatment option, either from us or from our partners. So let's collaborate with those great people we work with. So in terms of our products, here's the big thing. Genomic data is vast and complex. Interpreting it requires bioinformatics expertise that's in short supply, making actionable information hard to use. So we've come up with Seek for Life. UGenome Seek for Life. So NGS data interpreted without bioinformatics, making it faster, easier, and more clinically relevant. And we have 3 pipelines we're building: genomics, mostly pharmacogenomics right now, transcriptomics, and very, very soon epigenomics. So as of today's recording, October 2nd, 2025, we have done a lot of the genomics work and transcriptomics work, and then we're going to be moving on to epigenomics. So probably by the end of October 2025, we'll have a lot of the pipelines developed, at least at the prototype or not farther MVP stage, most minimum viable product stage. Now, talking about Seek for Life a little bit more, which is our multi-omics platform. Importantly, on the far left, you see it's good for labs, researchers, and healthcare practitioners, depending on the pipeline and their use of it. Really importantly, our big 3 things that we care about are cancer, rare disease, and women's health. Cancer is big and complex. It affects everyone in the world. Rare disease, there are 7,500 of them, if not more. Hard to detect. We want to do a better job, do our part. And women's health, very underserved group of people, 50% of the population, by the way, who's been underserved for a long time. So our focus is on 3 groups of diagnostics: cancer, rare disease, and women's health. And Seek for Life addresses all of them in different ways. So if you hear us talk about things in Seek for Life, always remember we're driving towards something very specifically: diagnostics for another human. So in terms of our product, it's not just built, it's crafted. So going from left to right. So our R&D is based on bioinformatics or computational biology. Similar, the distinct terms, but usually used interchangeably. This interacts with our software development, our data validation and analytics, and of course, medical affairs. We have to do a lot of training and so forth. Training is important for regulatory compliance. And of course, there's going to be a lot of testing along the way, syncing up all of the product development with strategic thinking. That's business development, getting customers to people to pay. And eventually, this has to be accessible for everyone because we care that people get good treatment. Let's do an introduction about our services. So broadly speaking, we have 2 types of services: bioinformatics services and PGX or pharmacogenomic services. Bioinformatics combines computer science, mathematics, etc., to get some readouts, some analyses that can eventually drive towards some good research, eventually some good clinical outcomes. Pharmacogenomic research and services has to do with helping people make informed decisions about their medications. So world of bioinformatics services that we offer constitute genomics and epigenomics, proteomics, transcriptomics, and metabolomics. And with one of our service partners, we're also offers some biomarker discovery services. And as we grow and find other partners, we might offer other services under our sales channels. The most primary one is called scientist.com. So we've done a couple of projects already, one for AstraZeneca. And in this case, we looked at extrachromosomal DNA detection. So in this case, DNA can float around in fragments, different parts of the body. And if you analyze that, you can get at some things that you can't get otherwise. But more importantly, you can maybe do easier detection with this ecDNA work. We also did a project for Boehringer Ingelheim, a metabolite identification and profiling project, along with our partner there in the bottom right, Christine Halt from Robust Diagnostics. The client had some metabolome analysis, and we did that along with the Arizona Genetics Core. And once we had some primary analysis from that, then we did some other further analysis for this partner. In terms of PGX services offered, we have personalized medication service, a BDC, business to consumer consultation, and some business to consumer SaaS products that we're rolling out this month, October 2025. So I'm putting it on here because there's a chance you're going to hear about it if you're around UGenome going forward from October 2025 on. Personalized medication service. So you participate in a short call, you get an at-home test kit, you'll swab your cheek, takes a few minutes, you put that the vial back into the box and send it off, and within a few weeks, you'll have a readout of medications you're going to be responsive to. And then you'll have a consultation with one of the UGenome pharmacogenomic people. In terms of our B2C analysis, so if someone already has their DNA sequenced, we can give them more actionable information. So give that individual sensible data in terms of pharmacogenomics and nutrigenomics. And they can take that information and make better decisions, hopefully, from better knowledge about the body they have and how they respond to medications and food. We're building out some B2C, some business to consumer SaaS products. So people, if they have some information already, we can give them a quick turnaround on some of the information they have already about their whole genome sequencing and their bodies and their genetic information, and give them actionable information they can take forward to their doctors and clinicians. Next thing we're going to talk about is continuous improvement, quality, regulatory compliance. So continuous improvements is really about excellence. Most people can do something very well one time, but how do you do something well over and over again? That's excellence, and that's what we aim to do at UGenome, be good over and over again. But how do we achieve excellence? How are we good over and over again? And that comes from very intentional thinking and hard work. So first of all, continuous improvement. So quality management overview, key UGenome processes, medical affairs, bioinformatics, various types of training. So after this orientation video, most of you will do some extra training for the things you're going to be doing for UGenome. We'll also want to say that your role in supporting quality is very important, and that's through training to make you and put you in a position to succeed. So quality management overview. So HIPAA stands for Health Insurance Portability and Accountability Act. This is very much about keeping patient data private. Good laboratory practices are very important as well for the work we're doing, trying to work with labs. And the FDA, of course, stands for the Food and Drug Administration. So we're building our regulatory things towards these goals. As I mentioned a second ago, there's also going to be department level training such as medical affairs, bioinformatics, software, marketing for you, depending on which department you work in most readily for UGenome. So this is to put you in position to succeed while you're UGenome. We don't expect you to be great. We're also going to help you be great by doing some basic training for your tasks. Your role in supporting quality is very important. So knowing your role and responsibilities and how they're relevant to UGenome is important. Now, many of these roles are still open, so you're going to be learning and teaching us in the meantime about your role, ensuring that you at all times are up to date with any training requirements, and being proactive in raising opportunities to improve. So we expect you to teach us things as well. Training processes and records. So the onboarding is the first step. We're also going to have some QMS training, quality control training. You have to confirm that you've read something or do some small quiz to show that you've understood some quality control systems training. And once completed, we'll keep those things up to date. And every once in a while, you have to go back and do some of the same training. Marketing introduction. So marketing is the activity promoting and selling products and services, including market research. So UGenome is very intentional about three things: branding, our social media channel choices, and that our content syncs up with our mission, vision, values, and our product. And we'll go through those in a little bit more depth. So branding is the promotion of a company by distinctive design. So we're very clear about our logo, colors, fonts, shapes, and imagery. That's to support our co-branding objectives with our partners, but very specifically for UGenome, it supports our logo and our overall brand and sense and feel. So for example, our logo symbolizes the intertwined nature of UGenome and genomic DNA medicine. The color has been chosen to represent both innovation and trust, and that's very important. We want to be innovative, and we want people to trust us to do good work for them, either customers, but in the end, people that we care about. Fonts, there's two of them, Montserrat for headings, and then Calibri or other fonts that are very similar depending on the application you use for the body. Shapes and imagery, the main one is circles about community, connections, and cells, the fundamental units of life. So we're very intentional about our branding. Our social media channels, the main thing is that channel you choose determines the packaging of services, content, and the presentation of the marketing. So we've been very intentional about our channel choices and the content we put on there. Primary is LinkedIn. The second one that we use quite a bit now is Instagram and Facebook. They're very similar. That's very much for a B2C, a direct-to-consumer audience. The LinkedIn is very much the professional industry audience, and that's where we focused most of our efforts so far, but we're expanding now to other channels as well. On YouTube, we put a lot of our videos. We're promoting a lot of content in Substack that's growing. We also have presences on TikTok, Blue Sky, and Threads. In case we ever want to go to those platforms, put lots of content, we already have an established brand out there, even if it's small. So really importantly, our content needs to sync with our mission, vision, and values and product development. So we have different types of content we put out there. So people, that's UGenome people. Our product development is synced up with a lot of really good writing and services as well. So for example, we might put information about our mission, vision, or mission, vision, and values on there. And surprisingly, we get lots of likes. The fact that on a once a week basis, we put content out there about our mission, vision, or values out there being on LinkedIn. Product development. So we probably once a week on Wednesday, the most popular day on LinkedIn, we'll talk about Propex or Seek for Life. So Propex is part of Seek for Life, as we talk about them separately sometimes. And the more you get to know us, the more you'll learn why we started Propex first as the leading part of Seek for Life. In terms of thought leadership article, we have UGenome writers that will get published in a national magazine such as MedCity News. But we also have an incredibly robust article series called Emerging Trends, about 40 articles now strong on PGX, pharmacogenomics, plus something else, and Hasna has led on that. I mentioned her earlier. We also promote our services, such as our personalized medication service or our bioinformatics services. So on Tuesdays, for example, we'll put a rate card out there so people get a sense of what we charge for our services. And again, we use scientist.com as our primary channel for bioinformatics services. Social engineering. So this is going to be very important for everyone. So there's 6 types of social engineering: phishing, vishing, so phone scams, baiting, pretexting, scareware, and smishing. Smishing is fraudulent texting. These are the most 6 frequent social engineering scams of 2025 and the ones we're most likely to see as UGenome people. So remember, all scams rely on trust. So people pose as legitimate individuals. The other thing is context. Using situations that could be relevant to you are also what scams rely on. And finally, some sort of emotion, oftentimes trying to get you to move very quickly because of some sort of perceived threat. Phishing. What is it? It's a cyber attack that leverages email, phone, SMS, social media to entice people to do something, such as give information. So the email phishing is the most frequent in 2025. What to do? If you come across it, do not interact, do not reply, report it. You can forward emails to this group and delete the message. Now, hopefully what you're going to be doing immediately is telling someone at UGenome you trust that you see something that seems suspicious. And likely, if you think something is suspicious, it probably is. And as long as we pause, we can contain it and move away from this very, very quickly. But be aware that you might see a phishing attempt to your email or text at some point, maybe even LinkedIn. Vishing, phone scam. So this is more for people who use phones a lot. So oftentimes in the United States, for example, people who are older who still use phones a lot, we're going to be more victims of vishing phone scams. Most frequent is AI and deepfake voice cloning. So what to do? Hang up immediately. Don't provide personal information. Don't trust caller ID. Scammers can spoof numbers to seem like it's a legitimate call. And if in doubt, call back to the legitimate company phone number and ask if this is legitimate. Might have to take 10 minutes to find the right person and report it, but that's always a good thing. So generally in life, pausing, taking a little bit more time is a good thing to avoid these types of scams. Baiting, what is it? It's a social engineering attack where scammers make false promises to gain personal information. So the most frequent is a fake bank in 2025. What to do? Kind of like I said before, research the seller's website. You can also go to Better Business Bureau to find out more about that company. Review our offers carefully. Read the fine print. Ask for additional information. If a seller doesn't want to provide that additional information, there's a good chance they're not legit. And avoid any instant payment type of things for yourself. So again, you might come across this in your personal or professional life, but baiting is a very frequent social engineering scam you might see out there. Pretexting, what is it? Well, pretexting is a social engineering scam that involves plausible scenarios or pretext that are likely to convince someone to share some data. So this is the one we've probably seen the most via text and I think even LinkedIn a couple of times. So the most frequent pretexting is impersonation. You might see a text, hey, this is Zach, but if you've never seen a text from me before, there's a good chance it's a scam because only a few people have my legitimate phone number. What to do? Well, first of all, educate yourself, verify the requester identity, and be skeptical of any unsolicited requests. Again, pause, talk to someone at UGenome you trust. If you think something's wrong, there's a good chance there is. Scareware, what is it? It's an attack when a user is attempted to be tricked into downloading unnecessary and potential dangerous software. The most frequent is spyware. So what to do? You can run a legitimate product specifically designed to remove spyware. So a couple of key ones are Lavasoft's AdAware, Microsoft's Window Defender, WebRoot's SpySweeper, Spybot's Search and Destroy, and Apple's Mac Keeper. Now, there's other ones as well. But for example, UGenome never sends any files to be downloaded unless it's a file between a product group, but they're likely going to use a different source. So never have I seen anyone at UGenome send something to be downloaded. Smishing, fraudulent texting. So what is it? So uh, fraudulent texting is very similar to some other things you've seen, but the most frequent one you're going to see is the QR code scams in 2025. So what to do? Do not respond. Even replying stop is a way to incentivize them to continue to scam you. Call the bank or merchant directly and ask them about this potential text. Check the phone number. Odd-looking phone numbers, such as four-digit ones, can be evidence of scammer tactics. As always, be suspicious. UGenome does not text people information. So if you see anything like this, there's a really high chance it's a total scam. Now remember, UGenome will never contact you via text or SMS for any official matters. Always verify unexpected messages with the line manager. That's the person you're talking to the most via Slack, Google Chat, or an official email before taking any action. As I've said a few times, always pause, take a few seconds, reach out to the person you trust in the company to see if what you received looks legitimate and is legitimate. That's always the main thing. Finally, here's an example of some signs of phishing. So first of all, in this message, this is not from a UGenome email, it's from a .ru, that's not UGenome. You can always double click to expand to see where the person is sending the message from. There's also an example of false urgency in this message. This particular message came in early October of 2025. So this happens frequently, and so we need to be aware of it. Thank you so much. So what's next? Well, you completed the onboarding quiz, or you're going to complete the onboarding quiz here in a few minutes. Schedule your success, so schedule times to meet the people you're going to work with on your team. Attend regular meetings and try to learn something new every day. So complete the quiz, regular meetings, and if you need a day off, your health comes first. If we're going to be any version of healthcare company, take care of yourself. So on the quiz, you're going to have to go back in the video and probably pause multiple times, but we hope everything altogether takes 1 hour to complete all of the onboarding you're going to have to do for UGenome. That's by design. We want this to be quick and relatively painless. Your first week, complete the onboarding training, connect with your team, learn about your projects, ask questions, learn more about UGenome culture, which is going to be ongoing, and then ask yourself, what do you want to learn and achieve from this experience? Because we want to give you a great experience you can take forward with you no matter what you do in this world. Your adventure begins now. Thank you so much. You're a very important part of the team today. we're very, very happy to work with you.